Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What does Cbqv stand for in pegfilgrastim? The Cbqv suffix is found in the biosimilar name for Udenyca, Pegfilgrastim The suffix is used to distinguish its name from the original reference product, in this case Neulasta, pegfilgrastim, which has no suffix. The suffix on biosimilars is used to help healthcare providers and patients realize the medicine is an approved biosimilar, but has no specific meaning itself. All biosimilars share the same core name with a reference product, but each one has a different suffix. The suffix is always composed of 4 letters that are attached to the original biologic name with a hyphen, assigned by the FDA. Udenyca is a biologic drug used to prevent neutropenia, a lack of certain white blood cells, caused by receiving chemotherapy, or increased survival in patients acutely exposed to myelosuppressive doses of radiation, which can lower red blood cells, white blood cells and platelets. What are biosimilars? Biosimilars are FDA-approved drugs that are highly similar to their brand name counterparts. Biosimilars are biologics for which there are no clinically meaningful differences in terms of safety, purity, and potency. These products are generally derived from living organisms, such as plants, animals, human cells, or microorganisms. Structurally, biologics are large and complex structures that are difficult to manufacture and replicate. Biosimilars are not automatically considered interchangeable with the reference product. A list of approved biosimilars can be found in the FDA's Purple Book. Biosimilars are expected to yield billions in cost savings for the healthcare system and consumers. Learn more. What are biosimilars? Top facts you may not know. There are 6 biosimilars for Neulasta, pegfilgrastim, all of which have a unique suffix. In June 2018, the FDA approved Mylans and Biocons Fulphila, pegfilgrastim JMBD. In November 2018, Udenyca, pegfilgrastimcbqv, from Coherus BioSciences, received FDA approval. Xiextenzo, pegfilgrastim MES, from Sandoz, was approved in November 2019. Nyvepria, pegfilgrastimcbqv, was cleared in June 2020. In May 2022, the FDA approved Fulphila, pegfilgrastimcbqv, from Amneal Pharmaceuticals. Stimufend, pegfilgrastim from Fresenius Kabi, was cleared in September 2022. Like Neulasta, all of these products are pegylated growth colony stimulating factors used to reduce the duration of febrile neutropenia, fever or other signs of infection with a low count of white blood cells, in patients treated with chemotherapy in certain types of cancer. These agents help lower the risk of infection due to a low white blood cell count. Neulasta, Stimufend and Udenyca are also approved to increase survival in patients acutely exposed to myelosuppressive doses of radiation. Neulasta and biosimilars of pegfilgrastim are given by subcutaneous, under the skin, injection. The Neulasta and Udenyca brands can also be given by subcutaneous injection using an on-body injector, Onpro for Neulasta, Onbody for Undenyca. Udenyca is also available as a pre-filled auto-injector. This is not all the information you need to know about Udenyca, pegfilgrastimcbqv, for safe and effective use. Review the full Udenyca information here, and discuss this information and any questions you have with your doctor or other healthcare provider. Related questions: what are biosimilar drugs and how do they compare to biologics? How do you increase white blood cells during chemo? What is the difference between Fulphila and Neulasta? RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.